As we bundle up and enjoy the winter season, a familiar foe is making its presence known: norovirus. This virus, which thrives in colder months, is notorious for causing outbreaks in places where people are in close contact, such as schools, nursing homes, and cruise ships. Its ability to spread rapidly makes it a significant public health concern. This highly contagious virus, often dubbed the winter vomiting bug, is surging in many parts of the world, causing a wave of unpleasant symptoms and raising concerns among health officials. Symptoms typically include severe vomiting, diarrhea, and stomach cramps, which can lead to dehydration, especially in young children and the elderly. Norovirus outbreaks are common during the winter months, but this year, the number of cases has been particularly alarming. The cold weather drives people indoors, creating perfect conditions for the virus to spread. Public health experts are urging people to be vigilant and take preventive measures. Hospitals and clinics are reporting a significant increase in patients with symptoms like vomiting, diarrhea, and stomach cramps. The healthcare system is feeling the strain as more people seek medical attention for norovirus-related illnesses. This surge in cases serves as a stark reminder of the importance of understanding norovirus and taking steps to protect ourselves and our communities. Simple actions like frequent hand washing, disinfecting surfaces, and staying home when sick can make a big difference in controlling the spread of the virus. The Centers for Disease Control and Prevention, CDC, is closely monitoring the situation and providing guidance to healthcare providers and the public. They emphasize the importance of hygiene and proper sanitation practices to prevent outbreaks. It's crucial to stay informed about the latest developments and follow recommended precautions to minimize the spread of this highly contagious virus. By staying educated and proactive, we can help protect ourselves and those around us from the unpleasant and potentially serious effects of norovirus. Norovirus is a group of viruses that cause gastroenteritis, an inflammation of the stomach and intestines. This common illness is characterized by a sudden onset of symptoms, including nausea, vomiting, diarrhea, and stomach cramps. Other symptoms may include low-grade fever, headache, body aches, and fatigue. These symptoms typically last for 1 to 3 days but can persist longer in some cases. While norovirus infection is generally not life-threatening, it can be very unpleasant and debilitating. Norovirus is highly contagious and can spread easily from person to person. It can also be transmitted through contaminated food and water or by touching surfaces contaminated with the virus. The virus is particularly resilient and can survive on surfaces for extended periods, making it challenging to control its spread. Norovirus spreads easily and rapidly, making it a significant public health concern. This highly contagious virus can affect anyone, and it often leads to outbreaks in places where people are in close quarters, such as schools, nursing homes, and cruise ships. The virus is primarily transmitted through the fecal-oral route, meaning it spreads through contact with infected feces. This can happen when an infected person does not wash their hands properly after using the restroom and then touches food, surfaces, or other people. This can occur through direct contact with an infected person, such as shaking hands or sharing utensils. Even a small amount of the virus can be enough to cause infection, making it very easy to spread from person to person. Norovirus can also spread through contaminated food and water. This is particularly common in settings where food is prepared for large groups, such as restaurants, cafeterias, and catered events. Food can become contaminated if it is handled by an infected person who doesn't wash their hands properly, or if it comes into contact with contaminated surfaces. Proper food handling and hygiene practices are essential to prevent the spread of the virus. Water sources can become contaminated with norovirus through sewage contamination or contact with infected feces. This can lead to outbreaks, especially in areas with poor sanitation and water treatment facilities. Another way norovirus spreads is through contact with contaminated surfaces. The virus can survive on surfaces for days or even weeks, making it easy to pick up and transfer to your mouth or nose. The virus can survive on surfaces for extended periods, and touching a contaminated surface and then touching your mouth or nose can lead to infection. This is why it is important to be mindful of what you touch and to practice good hygiene. This is why frequent hand washing and disinfecting surfaces is crucial in preventing the spread of norovirus. By taking these simple steps, you can help protect yourself and others from this highly contagious virus. Several factors contribute to the surge in norovirus cases this winter. The cold weather drives people indoors, creating environments where the virus can thrive and spread more easily. One significant factor is the increased indoor gatherings during the colder months. Families and friends come together to celebrate holidays, often in close quarters, which facilitates the transmission of the virus. As people spend more time indoors in close proximity to each other, the virus has more opportunities to spread. This is especially true in places like schools, offices, and public events where large groups congregate. Another factor is the highly contagious nature of norovirus. The virus is incredibly resilient and can survive on surfaces for days, making it difficult to control. It only takes a tiny amount of the virus to make someone sick, and infected individuals can shed billions of virus particles in their vomit and feces. This makes it easy for the virus to contaminate surfaces and spread to others. This makes it very easy for the virus to spread, especially in crowded settings. Public transportation, shopping malls, and other busy indoor spaces are prime locations for outbreaks. Additionally, the virus can survive on surfaces for extended periods, making it challenging to completely eliminate from the environment. Regular cleaning and disinfection are crucial but not always sufficient. This means that even if someone is no longer showing symptoms, they can still spread the virus to others. Good hygiene practices such as frequent hand washing and using hand sanitizer are essential in preventing the spread of norovirus. Section 5. Prevention is key. Protecting yourself and others. Preventing norovirus infection involves a multifaceted approach that includes personal hygiene, food safety practices, and environmental disinfection. By following these measures, we can significantly reduce the risk of contracting and spreading this unpleasant virus. Hand washing is paramount in preventing the spread of norovirus. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after using the restroom, changing diapers, and before handling food. If soap and water are not readily available, use an alcohol-based hand sanitizer containing at least 60% alcohol. Food safety is crucial in preventing norovirus infection. Wash fruits and vegetables thoroughly before eating. Cook seafood to the recommended internal temperature, and avoid cross-contaminating food preparation areas. Section 6. Staying hydrated, a vital defense against norovirus. Staying hydrated is crucial when you're battling a norovirus infection. Vomiting and diarrhea can lead to dehydration, which can worsen symptoms and prolong recovery. It's essential to replenish fluids lost through these symptoms to support your body's natural healing process. Water is the best choice for rehydration, but you can also consume clear broths, sports drinks, and oral rehydration solutions. Avoid sugary drinks as they can worsen diarrhea, and caffeinated beverages, which can contribute to dehydration. If you're having trouble keeping fluids down, try sipping small amounts frequently throughout the day. You can also try sucking on ice chips or popsicles to stay hydrated. If you're concerned about dehydration, consult with your healthcare provider. Section 7. Seeking medical advice, when to see a doctor. While most people recover from norovirus infection without complications, some individuals may require medical attention. If you experience severe dehydration, persistent vomiting, bloody diarrhea, or a high fever, seek medical advice promptly. Infants, young children, older adults, and individuals with weakened immune systems are more susceptible to complications from norovirus infection. If you or someone in your care experiences severe or persistent symptoms, it's essential to consult with a healthcare professional. Your doctor can assess your symptoms, provide supportive care, and rule out other potential causes of your illness. They may also recommend over-the-counter medications to alleviate symptoms, such as anti-diarrheal medications or antiemetics to reduce nausea and vomiting. Section 8. Latest developments, research, and medical guidance. Researchers are continually working to develop new and improved strategies to combat norovirus infection. This includes research into new vaccines, antiviral therapies, and diagnostic tools. Currently, there is no vaccine available to prevent norovirus infection, but several vaccine candidates are in various stages of development. These vaccines aim to trigger an immune response that protects against future infections. Antiviral therapies are also being investigated as a treatment option for norovirus infection. These medications work by interfering with the virus's ability to replicate, reducing the severity and duration of symptoms. Section 9. Staying healthy. This winter, final thoughts. As we navigate the winter months and the surge in norovirus cases, it's crucial to remain vigilant and follow recommended precautions to protect ourselves and our communities. By practicing good hygiene, handling food safely, disinfecting surfaces, and staying informed about the latest developments, we can minimize the spread of this highly contagious virus. Remember, prevention is key. By taking proactive steps, we can enjoy the winter season while safeguarding our health and well-being. Stay informed, stay healthy, and stay safe. If you have any concerns or questions about norovirus infection, consult with your healthcare provider for personalized advice.